Hello and welcome to Mental Health Awareness. I'm Dr. Ann Coretti, Director of Student Services for Nauset Public Schools. My guests today are from Gosnell. Kevin Rosario is an outreach representative. Patricia Metrocostas is Director for Prevention, and Laurie McCarthy is Director of Clinical Outreach. Welcome.
Thank you. It's great to be here.
Today we are going to talk about prevention, treatment, and recovery management. Let's begin with prevention. So you're the director.
I'm the director of Gosnell's Prevention Division, yes. The division was formed about 2 years ago. It'll be 2 years in January. And it was the result of looking at addiction as a chronic condition and expanding and shifting the continuum of services to include prevention and recovery. So with the Prevention Division, we have many programs in the community, in our schools, with physicians, with parents. Some of the programs include, we have clinicians in primary care offices that are doing screening for mental health and substance use disorders. We have clinicians in our schools throughout the region, elementary, middle, and high schools, about 14 of them throughout the Cape, doing much the same thing, screening for mental health and substance abuse issues, either their own or within their families. We have an overdose intervention program with some local police departments on the Cape. I believe about 4 police departments now that we're in, and we follow up with all overdoses with the victims and their families. We have community forums that are educational in nature that are spread throughout the region. Usually we do mid, lower, and upper Cape. We have prescription drug take-back days that we participate in with all the police departments throughout the Cape twice a year. We have a, excuse me, a Lock Your Meds campaign, which is a campaign primarily aimed at seniors to remind them to lock up their prescription medications. We do a partnership with the Cape Cod Baseball League called Playing Above the Influence, where we invite the baseball players to spend time with the young people in the community before a game. Chris Herron has been our special guest at many of the events. We had one in Orleans last year, and Falmouth and Bourne. So those are very successful community events attended by several hundred people. So again, to softly spread the message about not using drugs or alcohol to the young people, and allowing the Cape Cod Baseball League players to act as role models since they take a pledge to be substance-free. So those are just some of the initiatives we have.
So if someone wanted to get in contact with you, if they're thinking that maybe they need some support, and a parent or a spouse, they can call your division and say, I need some support. How does
Sure,
that
or
work?
information. They can certainly call the Prevention Division, and I'd be happy to direct them if it's something beyond education. If perhaps they need treatment, I can certainly send them in the right direction. And we do have a direct line with our Prevention Division. I can give the number at the end of the show if you'd like. Or it's 508-540-2317.
And so would it be a good idea for people to check with their insurance company to see if services are
excuse me, all of these services are, other than our clinical services that are in the schools and in the clinical offices, all the other programs are free of charge and are funded through philanthropic sources at Gosnell and through donations that we receive from Gosnell. But the clinical services would be funded through insurance companies, but no student or person in a medical practice is turned away due to lack of insurance either, or inability to pay. So it is open to all.
So have you been getting a lot of calls? How effective is the Prevention Division?
I think, it's funny, it gets busier all the time, which I guess is good because hopefully we're pushing the services to the other end, that actually trying to divert a crisis before it happens. So I think as parents have seen us in the schools and in the community, most of my calls are actually from parents that have questions about their child's use, what's normal, which we say no use is normal under the age of 21, or certainly should be advocated for. But many times parents just have questions about signs, about symptoms, about educating themselves. Primarily it's about marijuana and alcohol at the middle and high school age. But I think too with the opiate crisis, many parents are concerned about that, and community members, or perhaps they'll get a prescription that they have a question about and they'll call us. So we're seeing a lot, I'm definitely seeing a lot more of that than I did a year ago.
One of the things that you mentioned to me that sort of surprised me the other day when we were talking was about pill parties.
Farm parties,
right?
Farm as in pharmaceuticals, PH, not like the farm animals that we think, right?
Right.
We think everybody, right, we wish that everybody brought a farm animal or a little trinket of a farm animal, but we don't hear, thankfully, a lot about that on the Cape, but what it is that in order to be admitted to a party, you would have to bring prescription pills that are put into a bowl, and then kids randomly take a pill or two or three, not even knowing what they are. I mean, they emphasize that the kids would like them to be either an opiate or a Valium or some sort of pain pill or Ativan or
an Adderall.
Or Adderall as well, which is a stimulant. So all of those put in a bowl, and you take 2 or 3 of them, and you don't know what you're getting. Extremely dangerous. I mean, beyond dangerous for students that may even have some sort of a condition that they're not aware of that could cause seizures, death. I mean, that's an extremely dangerous practice, and oftentimes mixed with alcohol at these parties as well.
So one preventative measure is for parents and just anyone who has prescription drugs to count the pills periodically.
Or to lock them up.
There
are safes that are, sizes that can be stored in a drawer, locked safes. We also recommend that folks dispose of their medications in the drug kiosks that are available at all police departments on the Cape. You just walk in and they're in the lobby, and you just place the medications. It's like a mailbox ATM type of a machine. You just open the slot, put the medications in. There are no forms to fill out, no questions asked. So if you're not using your medications, either dispose of them or lock them up.
So what do people do? Bring in the bottle?
They can
and
bring in
take
the
their
whole
names
bottle.
off,
They can cross out their names. They can bring them in with the bottle, or just the pills in a baggie, however they're more comfortable doing it. But you can do it either way. And 70% of kids who start using prescription drugs get them from a friend or relative in a medicine cabinet. So it's a very accessible point, and it's a temptation that if we, just another way to remove access. So
good to know. Thank you.
you're welcome.
Let's talk a little bit about treatment. There's different types of treatment. There's the physical type of treatment for someone who's alcohol dependent or opiate dependent, and there is, of course, along those lines, the psychological treatment too. They go hand in hand.
Right.
You really can't dissect it. But can you talk about length of stay, what kinds of treatment there is, and how does someone get into treatment, and just a follow-up question before you answer. When people get into treatment, sometimes they're recommended by someone else. Do they stay in treatment? So if you can kind of shed some light on that, that would be great.
Give that one to you.
Sure. So anyone can call Gosnold in. It can be a family member, it can be an employer concerned about someone's use. It can be the person themselves. And they're going to have a conversation with someone from our admission staff. Not necessarily that it's going to result in an admission, but they can get an idea of what kind of services they're going to need based on the information that's provided to them. So things that the admission staff will ask is, how long has the use been? What are the substances that are being abused? Is there a dependence at this stage? How old is the person? What is the prior history? Is there a mental health diagnosis along with it? Have they been in treatment before? So all of these questions are asked, and then based on the answers, there's going to be a determination as to where the treatment is going to occur. Either it's going to be outpatient or it's going to be inpatient. Obviously, once a person is dependent on a substance, it usually results in an inpatient stay.
Is the time different for opiates versus alcohol?
A little bit. Alcohol has a longer medication protocol, and usually that's 5 to 7 days. Opiate withdrawal and that medication protocol can be 4 to 5 days. Again, depending on the severity of the condition and where they're at in the stage of the addictive illness. It determines everything at that point.
So if I was alcohol dependent and I didn't want to get involved with Gosnold, and I say to myself, okay, I'm just going to go cold turkey.
Awful idea.
Very dangerous. So alcohol is the most dangerous substance to withdraw from. It can result in seizures. Very, very dangerous. The most dangerous drug if you are alcohol dependent. So
You can actually die trying
Yes.
to do that on your own.
Alcohol and benzodiazepine are the worst ones. The opiates, it's flu-like, and you feel like you're gonna die. It's very uncomfortable, but you can actually ride that out. The alcohol and the benzos require medical treatment and supervision because it could result in death.
So if someone is uncertain or afraid to call a place like Gosnold, they can call their primary care. The primary care doctor is going to make a referral to a medical unit, stabilization. So whether they make that initial call to us or they call their doctor and they're honest with their doctor about being dependent, their doctor will refer them to an inpatient program that will treat alcohol withdrawal.
So when you say inpatient, it could be a regular hospital?
Well, most hospitals don't have detoxification units in the hospital.
Okay.
There are very few now in the state. So it usually requires a Gosnold or a treatment program such as ours.
Well, that's really interesting, and that's something that families and friends need to be aware of.
Yeah, and so if they call, they're going to, if there's a family out there or a person out there that has a question about where they're at in the spectrum, if they call Gosnold, they're going to get an awful lot of information. What our goal is for every caller, that every single person that calls is going to feel better when they hang up the phone. That they're going to get their answer, their questions answered. They're going to be given some direction. They're going to understand a little bit more about what's happening with them. Our admission staff is very skilled and trained in being able to speak empathetically with patients and families. We are in the, really in the business of educating and supporting the people that call our programs because it's a very difficult illness.
Do people have to give their name when they just want some information?
No.
Okay. So they could just call and say,
Sure.
I'm wondering about
I
this.
need some
and-
information. I take a lot of those calls as well. People will call my, because I'm on the website as the outreach director. I'll get a lot of calls for, this is what's going on with my son or daughter. This is what's happening with my spouse. And depending on what that is, I can then offer some comfort, offer some support, some suggestions. You're going to be okay. There is a solution to this. There's help available. There's tons of help. We can get you that help and, try and, calm it down because typically when people are calling us, they're in crisis.
So if the person who is the client, let's say, doesn't call, say it's a friend, and the friend says, I really think so-and-so should be in treatment, and the person agrees to go to treatment. If they don't do it on their own, and I don't want to use the word forced to treatment or pressured, or do they usually stay?
Yes.
They do.
Yeah. Because really, the hardest part is getting them to the door. So for us, it doesn't matter how they get to the door, whether it's a family member, whether it's a friend, it doesn't matter to us. If you get them to us, because we don't expect people that are in a cycle of active addiction to be able to cognitively make some really healthy decisions for themselves. So we expect them to, if you come to us, then when we get them, then we can work with them. We can start to address their concerns. We can offer them the support that we think they need, and the care and the respect that we have for this illness that we are going to educate them on, that this is a chronic condition, this is an illness. We take the shame, the blame, all of those stigmatizing things that go along with this illness. We really try to remove all of that, and so we educate them, we support them, we're as you like to say, we love them up a bit. And
Love them up, wrap them up.
wrap them up in services and love them up so that they can be open to the healing process and what that might look like, which is usually, and we're going to tell them, it's treatment for a long time. And whether that's outpatient or inpatient, the next stage is that people, we believe, need to be engaged in some sort of treatment for at least a year. And it can look differently for different people, depending on, again, severity of the condition, the history, the age of the person. But there has to be services that they are exposed to and that we can provide for them for up to a year.
So, Kevin, let's talk about recovery management.
I'd love to do that.
And what that's about.
Okay, so I mean, there's a lot to recovery management, I guess. I guess the premise behind it is it's not a short-term fix to this type of treatment. So, like the model has typically been, get them to detox, get them to detox, get them to detox, but that's just the beginning. It's like you've taken these chemicals out of them that appear to be the problem, but now you're left with an untreated problem. There's something else going on, whether, it's anxiety, depression, coping skills. Maybe it's a trauma, maybe it's nothing. Maybe they've just had an injury and they got that route. But regardless, once it's taken away, there's some stuff that they need to work on. And we try to love them up and wrap them up in services. They need a lot of support. So we try to keep them engulfed in like this whole process of recovery and give them as many supports as possible. So you'll see like a person that comes in that just leaves, he's on his own, doesn't have a lot of family support, is going back to the same environment. I mean, statistically, his chances are not very good. Nothing has changed. You remove the substance and you sent him back. But if you get a person in and then you get him to, some extended care, go to Katamit or to a rehab for another 30, give him a chance for the brain to start to heal, for the normal body functions to kind of kick back in where you can eat and sleep and do those regular things that we take for granted, then I feel like we kind of say, it's not a clinical term, but they kind of thaw out a little bit, where they can start to be a little more awake and alert and make better decisions. So then it's like, all right, we're going to help you. We're going to coach you and guide you on what you need to do to give yourself the best chance of success. So we have, nationally certified recovery coaches. We have an intervention team. We have a whole continuum.
Family support groups that are free.
We got the counseling. We got Withdrawal psychiatry. So the goal, if we get a patient and we can keep long enough, is to literally wrap them up and isolate them with as many services as possible. Get them into a healthy recovery environment. Outpatient counseling. We love the Withdrawal, especially for the opiate addicts, because it's a medicine that basically blocks the opiate receptors and doesn't allow them to get that euphoric feeling
if they do use.
If they do have a resumption of use. And that sometimes that just helps with the craving, because psychologically I know if I have a bad day and I pick up, I'm not going to get high anyway. It might help them get through that moment. That moment might pass, but that's just one tool. So they got Withdrawal in case they have a bad day. They got a therapist that they can talk to on a weekly basis. They can go to a psychiatrist every month as they go through their recovery process to be properly diagnosed and adjusted and to get a good look at what that really looks like, what their baseline looks like after active use. You know, you get them hooked up with a sponsor in a recovery house. They go to meetings every day. And we look at like complete health and wellness for the patient and the family. So physical, mental, spiritual, emotional, you know, we don't even talk about a job for a while. Like, if we can help it. People come in, they have kids, they have mortgages, and you gotta, that's where that custom tailoring, that personalized service comes in. You gotta work with a CEO that comes in. He's not gonna go to a 6-month program and surrender his whole life. So what does that look like? How are we gonna give him the supports he needs to be successful? How can we direct the family to the family support groups and educate them and give them the support that they need? And what I love about Gosnold is that piece. So the patient comes in, he goes to long-term treatment. He's got a nationally certified recovery coach who calls him 5 days a week, visits him twice a week face-to-face, basically holds his hand through the treatment process, is the thread between all his providers, make sure he makes his appointments, make sure he's staying in recovery, that he's getting a sponsor in a home group and what that looks like. And then the family's just at home like waiting for the phone to ring. This guy's wrapped up. He's got all the best, highest level of care that's out there, and the family is just afraid. So we say, no, we want to help you too. You know, it's not your fault that this has happened, but we're in it together. And every month in the recovery management program, we bring the family in. And we challenge them the same way we challenge the patient. What are you doing? How are you doing? Are you taking care of yourself? You know, are you going to the family support groups? You know, and we give them little goals and little tasks so that they can start to heal while we're working with the patient. You know, and every month we talk about these are the things that are going well. These are some of the things we need to work on. And it's not like a, you know, like a negative thing or a punishing thing. Like if I brought my family in and we talked about some of the things, there's some things I could work on. You know, so there's always that. And I try to tell them that it's not a punishing thing. It's not like a overbearing, authoritative thing. It's just like, we care about you. We want you to have the best chance of success. And if you do these things, you'll drastically increase your percentage of success. And you got to meet everybody where they're at. They come in and they're ambivalent.
And the other beauty of this program is that it's a mobile team. So people are used to, after treatment, they have a continuing care plan. So you're going to go to your therapist, you're going to go to your medication manager, you're going to do this. But what happens in between all of those things? So the beauty of the coaching team is that they're mobile, and they're available 24/7 to families and patients. And so we'll like drop in the 4 walls of the, you know, no more, you're not sitting in a counseling session in an office with your counselor. It's happening in real life, in real time. I think a year and a half ago or so, our CEO came in and, how's it going? You know, what are you guys seeing out there? How's everybody responding? And one of the supervisors of the program said, well, you know, they're going to meetings, they're going to see their counselor, they're doing this, they're doing that, but it's like they're 25 years old. Is this all there is? So how about some recovery socialization? Let's do that. So a lot of this is funded through, like on the prevention side, the recovery management side, a lot of it is funded through philanthropy and generous donations of amazing people. But it was, let's do something healthy, and it was winter, and so we took 30 kids, 30 young adults up to Loon for a day. We did skiing, snowboarding lessons. We had a dinner, a recovery dinner. There wasn't a dry eye in the house. We got calls from parents, like it was, they were trying new things, or they hadn't been on skis, or they had never been on skis without using marijuana or drinking. And so we do fishing tournaments. Our female coaches, for some reason the girls, they just want to go to a concert. They want to go to a concert, and they're afraid to go to a concert because they're not used to going and not using. So the coaches go to these concerts, and the pictures we get back are, I mean, and then inevitably with this group, all of a sudden, they're going back to school because they have one semester left. All of a sudden, they have a job. All of a sudden, it's
Nice.
you know. So we brought in a girl in our coaching program with her mom, a few of the patients and their families, to speak before some legislators, state legislators. And one of the questions one of the legislators asked was, when you were 10, what did you want to do? What did you want to be? And she said, I wanted to be a teacher. And he said, when you were 17, what did you want to be? And she said, I didn't want to be anything. By then, I'd started taking pills, and I was addicted to opiates, and I didn't want anything. And she's coming up on a year of sobriety and recovery.
That's great.
And he said, what do you want to do now? And she said, I want to be a teacher.
Oh, that's nice.
So we have a lot of stories like that. So we believe that recovery management and that extended piece that has been non-existent in the treatment field till now is one of the answers to extending remission periods, so that it's not the current paradigm is, right, you admit to detox, you discharge, you're back in, you admit. If we can do that, then we won't need 10,000 treatment beds in our state.
So let's get back to families concerned or friends are concerned about someone. What are the do's and don'ts of talking to someone and expressing concern about trying to get someone some help? If there are do's and don'ts.
I think just a personal opinion is that first thing is just to be honest and caring and loving and just kind of be gentle about it. Because the best approach, best case scenario is if someone, not to say confront because that's more aggressive, but if someone just questioned or asked, hey, are you okay? Is everything all right? You've been sleeping? And just kind of go in that roundabout way, because if they self-disclose, you're in a better position with that individual. The individual is open to help. They're bringing it out, and it's in a loving way. It's not accusatory. I think that's the best case scenario, is just to question and say, we care. Don't take this personal. If a person is more closed off and protective, I think then you got to be more direct and say, hey, you can say everything's okay, but this is what I see. And I love you enough to not care if that hurts your feelings, because I can't be one of those parents that just let it go by. And tell them, this is what I see, this is what's changed. You can't tell me that there's not something, because some of them are so obvious, and they're going to deny and hide and evade. So you try to hit them with love first, I feel, and if they're not responsive to that, then you go direct. And if they're not responsive to that, that's when you call the professionals and you say, I got this family member, I got this loved one that is not responding. I'm afraid they're going to die. Or maybe it's not that. I see them going down a path that is dangerous. Can we talk to them now before it becomes...
And that can be any age.
Yeah.
It can be...
And follow your instincts.
Any
That's something I
age.
tell parents all the time. Follow your instincts. If you really think something is wrong or something's different, something
probably
probably
is.
is. And it doesn't mean that the help isn't there and the support isn't there, but follow your instincts.
Well, what if it's a spouse who's concerned about a spouse?
Yeah,
I think it's the same.
yeah,
It's exactly what
it's the
Kevin
exact
said. It's the same
thing.
philosophy. I love you. I care about you. I'm concerned that I see changes in your behavior, or I see maybe changes in our relationship. I think it's all the same with love, with kindness, and depending on the degree and how open the person is, then you sort of proceed from there.
Well, it's the same, and if they had any other condition, it's for at any age. It's I'm concerned about this, and I tell families to say, I'm at a loss as to how to handle this, or even what to do. So I'm calling I've called a professional who knows, and I'd like to, I'm going to bring them in. I'd like to have a meeting. We're going to have a session. We can go out to their home. We can do it at an office. Whatever is the most convenient, because it's we have to be sensitive to, we want to make it easy and the access easy for a conversation like that. So we have a family reaching out program, and that's what they do. Let's have a conversation with a professional. Let's let the professional decide or make an assessment as to what's happening here.
Can you give us that number for the family outreach?
It's the same number for if they call the 800 number, they can ask for the family reaching out program and go directly to that.
So the 800 number.
800-444-1554.
Okay. I want to make sure we get that. Any last thoughts before we wrap up?
It's been a great Thank you for having us.
Yes,
the
thank you.
more we can get our information
Information.
out there, the more people we can reach as to, it's not, you don't just call Gosnell because you got to go to detox.
That's right.
Call us for anything that you are concerned, don't have an answer for. Just where is somebody at in the spectrum, if they're even on the spectrum.
So the takeaway message from this is there is help.
Absolutely.
People are there to help you. And
and
There is
recovery is
hope.
possible.
People do get well.
People do get well, absolutely.
People do get well with the
People do.
right supports.
That's
People can
right.
bounce back and be the most productive members in society, the most creative, amazing, intelligent people. I've met some people in recovery. You
That's
just got to
right.
give them a fighting chance,
oh, I like that, Kevin. Laurie, Kevin, Patricia, thank you so much.
Thank you.
Thank you.
Thank you for having us.
My pleasure.
Cool.